Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. This channel is dedicated to amplifying the voices of doctors, other healthcare professionals, and patients as they share their unique struggles, triumphs, and passions. My mission is to build connection and create advocacy for healthy doctors, driving positive change that benefits both doctors and patients. This is a space for everyone who cares about the future of healthcare. If you appreciate this content, please like and subscribe now. It really helps the episodes reach our target audience. And this episode is brought to you by The Developing Doctor, a coaching program by Dr. Ben Ranking that helps physicians grow with purpose in medicine and beyond. You can find Ben at thedevelopingdoctor.com, contact information in the show notes. And now on to the show. Today, I would like to welcome Dr. Josh Hartzell. Thanks for joining us today, Josh.
Great to be here, Kim. Really looking forward to our discussion.
I can't wait. And by way of introduction, Dr. Josh Hartzell is a retired Army colonel who spent 25 years in military medicine. He's an internal medicine and infectious diseases physician and author of A Prescription for Caring and Healthcare Leadership, Building a Culture of Compassion and Excellence. And thank you very much for sending me this autographed copy. I love it, and I've dog-eared so many pages. We could probably have a whole series of discussions on Stand Up for Doctors about your book. And I will mention that Dr. Purv Gupta was going to join us, and we're not quite sure. So if he hops on, we'll welcome him with open arms. And in the meantime, we're just going to go ahead. And today we'll be talking about how can we bring caring, love, and compassion to healthcare systems. What is your vision? What is your hope? And I would first like to ask what you'd like our audience to know about you. You can include hobbies or and whatever you want.
So thanks for the introduction. And I love seeing the book with all those little dog-eared pages. That warms my heart. A little bit about me. I am a internal medicine infectious disease physician. I was in the Army for about 25 years and then recently transitioned to a new role as a civilian. Aside from sort of my clinical practice, I've had a real passion for faculty development and in particular leadership development, which started about 10 years ago. And I think just leadership is critical. And the more and more I saw us facing issues and challenges within the healthcare environment, and really you could say the world, what I realized is all of them are leadership issues. So trying to figure out how to influence that and help people become better leaders really became my passion. Outside of work, I have two kids who keep me busy with flag football, basketball, baseball, and just kind of driving them around, which is, my big passion is supporting them and helping them to develop into future leaders. And then I think, interesting things maybe I love to cook and I love to eat, which is also why I work out. Not so much, I do like working out, but I love it more so that I can cook and eat whatever I like.
Well, I love all of that, and I believe that you live very close to my daughter, so I'm hoping that I'll be able to meet you in person someday on a trip down there. And of course, you're always welcome to Connecticut. I've been to all 169 towns, so I could show you around. So, so I think in our last conversation, did I mention Simon Craig's book to you at all?
I think you
From
did, yeah.
hurting to healing, delivering love to medicine and healthcare. The reason I'm bringing it up when you mentioned these issues ubiquitous around the world, he's in Australia. And when I read his book, that's what I thought is that some of these leadership issues and caring issues are ubiquitous, like around the world and over time. And we can all learn from each other, and we need to find out what is working. And when I read your book and dog-eared all those pages, I tried to write some notes about what we might talk about, but I didn't even get all the way through the book, and I had so many notes. Like I said, I didn't even know where to start. So I know that we won't be able to touch on everything, but I always ask our listeners to share a powerful story. So if you would like to get started with that.
Yeah, sure. And I think your point about like, having the friend in Australia. I got to meet and talk with Cheryl Martin, who you probably know as well. This is really a group effort. We need everybody at every level in every city, town, nation to think about how they take care of the people around them, whether it's at work or home, all those environments. For me, the story that I think when I think about the book and the idea of caring, it often goes back to when I was a kid and my mom, who really exemplified caring and taught me a lot about how to care as a leader. She was a customer service manager at Walmart, so spent the majority of my early childhood as a stay-at-home mom and then transitioned to working at Walmart. And she would come home and just tell me these stories about what she was doing at work and how she was taking care of other employees. And this transcended the work environment where, if somebody had something bad happen in their family, the people there, they rallied around them. They would take food to their houses, they would mow their yards, like whatever they needed. It was very clear they were part of that, larger sort of Walmart work family in our community. And we're from a fairly small community, so I think that's a natural thing that we did growing up. And then, as my mom, later in my life, she had breast cancer. And one of the things that really stood out to me was, obviously she cared about me and my brother, but right towards the end of her life, like it was clear she was going to die. She was on hospice, and I was home from medical school, and she made the point of making sort of this one last chocolate chip cookie birthday cake because it was my birthday, and like it took sort of almost everything she had to make it, but it just signified the amount of care and effort that she wanted to and to give to us. But I think the bigger gift was actually role modeling and just showing like how important taking care of people is. So, everything I do sort of stems from being raised that way and just recognizing that whether it's, somebody at home or somebody at work, that we need to treat them with care and respect. And if we do, they're going to do great things for you. My mom didn't have to necessarily like, I'm sure as a kid, I probably was not always the best listener. But certainly later, like in my life, like, I wanted to do things well to make her proud. I wanted to do things to, help her feel like she had done a good job. And I think it's the same way at work. If we treat people with that level of love and caring, they'll do amazing things for you.
Well, that's so beautifully said. And I had extra starred a few things from your book that I thought we'd get to touch on. And that was the first one. And I teared up when I read it. And I teared up when you shared that again. And I just want to give you a big hug. And, that's a beautiful and powerful story. And it exemplifies that. And I don't know, are you familiar with the book, The Fred Factor by Mark Sanborn?
No.
Okay, when we're done, I'll send you the link, and maybe I should put it in the show notes too. He wrote about his mailman named Fred, who
Mm.
also exemplified, I don't know if you'd say leadership, but just caring about other people, and how this mailman went above and beyond. And there's someone that works at our local ShopRite grocery store. Her name is Jacrudy, and she too exemplifies that. And I actually even took a picture of us once, and I did a post about it to just share how it doesn't matter your role, right? Your mom worked at Walmart. We're talking about a mailman. We're talking about a cashier at ShopRite. And she always has the longest line because people feel seen and heard. And she's always has a hello, how are you today, my friend? She wants to know about your family and everything. We have, private jokes, right? And stuff like that. And
Yeah,
it
no, and
just
I,
makes a
I think
big
the point
difference.
you just highlighted, it doesn't matter what role we have. We could be, I like to joke, you don't need to be a king or a queen or a dean.
Yeah.
All of us have this ability to positively impact that person's life in front of us. Just a couple weeks ago, I was on inpatient infectious disease, and I was in the hospital, and there was this, elderly lady who was sort of struggling to get to the elevator, and this very nice, kind food service person came out, and basically, like, he just happened to see her, and he walked up, like he was kind of in front of her. I was coming up from behind, and I just saw him walk up, and he kind of helped her and like asked her where she was going, got her in the elevator. she was like beaming and smiling, and you could just see how much of a difference he had made just by that small act. And again, we have medical students who can have a huge impact. Anywhere along this continuum, it's really a choice about how we want to interact with those people who are closest to us.
True. And were you on Jeffrey Smith's podcast? Jeffrey, do you know Jeffrey Smith?
No,
Okay,
huh?
he's a healthcare leader here in Connecticut, and he has a podcast called Moments of Experience, and Mo is his dog, and his wife was going through a very serious cancer. And speaking to food service workers, he shares a powerful story how one day his wife was in the hospital, very ill with cancer, and she was crying, and he's like, what's the matter? And that food service worker wasn't there that day, and he says whenever she comes she sings when she brings me my lunch, and that was just like a touch point for her. So the littlest, sometimes the littlest things can matter, and that's such a powerful story for him, and it even helped him switch gears. I think he had a like kind of a high power job, doing things, but he has since left, and he's trying to make a difference like we are, and he's really shifting in what he's doing. Once he saw healthcare from the perspective of a patient and the spouse of a patient, it took on a whole new different meaning for him. And
Yeah, and
speaking to one time where it's the opposite, another powerful story I thought you shared was the time that you wish somebody would have asked you how you were doing when you were in med school. I don't know if you wanted to quickly speak. You said, I wish someone would have simply asked if I was okay, if I had thought about seeing someone because I always look so tired. If you wanted to.
yeah, that story really relates around like your own personal health. And for years at work, I would fall asleep during the middle of the day. We had a conference right at noon. Anytime that conference was going on, I would doze off to sleep. And we have an annual skit where we kind of make fun of the residents. The residents will make fun of them. It's fun. It's lighthearted. But they would always have a part where I was sleeping in conference. And right towards the end of my military career, I actually Dr. Kevin Chung, who was our chair of medicine at the time, I was having dinner with him, and he was talking about sleep apnea and how he had been diagnosed, and how it had been like a life changer. And as I was sitting there, I was thinking like, oh, that's interesting. So I ended up getting tested and had pretty moderate to severe sleep apnea. My colleague, who's a sleep doctor, had basically texted me, and he's like, dude, I feel so bad for you. You have terrible sleep. And yeah, so I got it treated, and now I feel just remarkably better. And I think, the story was sort of, wanted to be a little bit humorous, but also like just, yeah, asking people how they're doing and thinking about your own personal health and making sure that you're taking care of yourself. We all get so busy that we want to take care of others, but we forget to take care of ourselves, or we don't prioritize our own health. And we know that when we do that, I mean, we know this like as healthcare providers, it's not good for us, but yet we sort of take this martyrdom stance of, well, I'll take care of my health later. And I really think we need to shift that. We need to take care of our health first so that then we can be the best, possible version of ourselves when we're trying to take care of others.
Right, 100%. And tangentially related to that, another quote from I have from you in your book is shouting self-care to people who actually need community care is how we fail people. And that's why some doctors hate like wellness programs and all that stuff, or when people try to say just be more resilient, right? So, but I say over and over again is that there's a difference. Like, yes, the system needs to change, and yes, what we need is community care. And that's what your book is about and what we're talking about. And individual doctors can do things to resource themselves. So if you'd like to expand on that quote.
Yeah, sure. To me, we've seen a lot about burnout, and often it goes back to, well, oh, if we could just have more resilience, or how do we fix the individual? Well, the fact is, we take the most resilient people in the world,
Mhm.
and then we put them in the culture of medicine, and we beat them down. And I like to it's not really funny, but like if we don't beat you down in medical school, we'll beat you down in residency. And if we didn't get you in residency or
Mm-hmm.
medical school, we will definitely get you as early career, mid-career, or late faculty. It's like this, gauntlet you have to run through. The issue is that we can't fix the problem. We don't need to fix the people. We need to fix the system, right? What does that look like? So we need to really take a deep dive in our systems and look at processes that don't make sense. We
Mm-hmm.
need to look at workplace environments and think about schedules and think about staffing models. We need to think about just how we communicate with each other and respect each other. We need to think about connection at work and are we connected? Do we have any friends at work? We talk about these things. Do you take your vacation? Right? There was a paper published last year. I love this paper. I think it was last year, maybe the year before, right? But that not taking vacation, surprisingly, leads to burnout. I mean, not novel idea, right? But it's data. And the other thing I really like about this is we're starting to see healthcare researchers look at what is the actual evidence for certain things that we're doing. And why I think that's critically important is I can go to a hospital director or CEO or chief medical officer and say, look, you need to implement these processes or these ideas, not because it's a feel-good idea, but because the evidence shows that it works. It
Mm-hmm.
shows that it decreases burnout, it improves job satisfaction, and oh, by the way, it impacts retention, which retention, right? We know if you lose a physician, it's 500,000 to $1 million to replace them. So we need to start taking some of that money that's lost
Right.
from burnout and other things and being proactive. The one thing I've been sort of thinking about recently is, we need to move to primary prevention of burnout. We need to stop getting to that stage and saying, okay, how do we treat it? But let's prevent it. Let's put systems in place so that we don't get there. So that the next generation of physicians, nurses, allied health professionals don't have to have 30, 40, 50% rates of burnout and then we're trying to backtrack. Let's be proactive about this and have primary prevention.
100%. And that speaks to doctors and patients where we need primary care prevention. You know, the famous thing about if people are falling in the water, right, and you're picking them up downstream, instead of keep picking them out of the water downstream, go upstream and figure out why they're falling in the water in the first place. So that speaks to primary care and for patients preventative, and then also what systems need to do for their healthcare workers to prevent that. So I agree 100%. And then I think that the healthcare leaders need to see the bottom line. And I've heard that statistic as well, that it costs 500,000 to $1 million to replace a doctor. So that should matter to them, even if it's for self-preservation of the hospital or the system, that we need to care, and
Yeah,
go ahead.
I was just gonna say it pains me a little bit. Like it's the right thing to do, right?
Yeah.
We shouldn't need incentives to do the right thing. But if you do need incentives,
Yeah.
there is a clear financial incentive to do these types of interventions because it's going to lead to better patient care. We know that when you have burnout, it leads to worse patient care. It leads to provider issues like depression and suicide and alcoholism and other things, right? So if we can fix the burnout issue, we actually get better care. It
Yeah.
saves us money. So if you're not driven by just the right thing to do, yes, there are financial incentives as well.
Yes, it's a win-win. Yeah, we need to shout this from the rooftops. So to make a slight pivot, one other thing that you mentioned in your book that really interests me is when you talked about the feedback sandwich, which is kind of like, which I've done myself, and it's kind of like sandwich some like important or critical feedback, which would be the meat in between like two compliments, right? Like something like that. So I have in my own mind a couple examples where I've done that. And actually, in like, I have some training in crucial conversations with a couple doctors of my own. And I feel like it could be an example, it could have been recorded as a good example of a way to have a successful crucial conversation as a patient with a doctor and move forward where everyone feels safe and heard and supported. Like I think we were all ended up satisfied with those conversations. Then conversely, I recently, now it was through texting, not an actual conversation, which can be the problem too, is I tried that and my message wasn't really understood. Like exactly to your point, that the person ended up being confused, kind of like, well, are you offering me some critical advice or is this a compliment? Like they were actually confused. So if you would like to speak, so then that really made me, because I thought the feedback sandwich is the way to go. So if you could speak a little to that and educate me.
Yeah, that's so I didn't realize how prevalent feedback was in the book and in leadership until recently. I was like, oh, let me look. Like feedback is in the book over 420 times, where we talk about like the word feedback. There's three separate chapters on it: how to give it, how to receive it, and how to sort of give and receive it as a leader at an organizational level. The feedback sandwich, it really, I think before we get there, you have to step back and think about more like the idea of how do we approach feedback and set up a culture of feedback. And I lay out a process to do this in the book, but the bottom line is establish the relationship first. Build trust with the people you're working with. So if you know, Kim, that I care about you and I want you to do well, I want you to be successful, and I will probably do that by giving you positive feedback over time. Like, Kim, I
Mhm.
love your book. This is amazing, right? There's some great stories in here. This is going to change people's lives, right? And I'll give you that positive feedback to help build that trust. I might do other things for you, such as, give you opportunities to stretch yourself with maybe assignments, but I build that trust up and I've given you the positive feedback. So sometimes people think, oh, we don't give positive feedback. No, positive feedback builds the relationship so that ultimately, when you need to give constructive feedback, you can basically take a withdrawal. You're putting all this money in the bank, and then now I'm
Mhm.
going to take a withdrawal and give you some constructive feedback. When you give them together, the feedback sandwich, part of the problem is let me give you a little bit of positive feedback that may or may not be sincere at the time, because what I really need to tell you is this really challenging thing that you're doing. But let me, give you a little bit of positive feedback at the end because I don't want you to feel bad. The problem is it gets lost in the mix. The other problem is a lot of people now, especially when they're expecting feedback or they think like, oh, I'm going to get some feedback, it's almost like they feel like that's just insincere. Just tell me what I really need to
Mhm.
know. So I think it's that process, build the relationship, give positive feedback, and then when you need to, just be direct, like deliver it in a kind way. Hey, Kim, I noticed that you were doing this. I just want to point out that I don't think that behavior is going to be helpful for you. What do you think? And then we can have a discussion. And then, look, here's an action plan for how you could improve that. Right. And you don't need to sugarcoat it with fluff on both sides because it gets lost. It gets lost in the message. And then your ultimate goal, which was to actually help the person, isn't achieved. So
Mhm.
there's data that have looked at feedback sandwich, and that's sort of the things people think about is that it's confusing or people know you're not being sincere with the positive part. So just make it clear, be kind with the delivery, and help people. The other thing I'll do is I'll just tell people, look, I need to give you some feedback. I care
Mhm.
about you. I care about your performance. I would feel bad if I didn't tell you this. And then I give them the feedback. And I just lay it out there. Like I lay the caring on top of the feedback. And often that works. There's obviously times when it is a more challenging discussion.
And that's a fantastic explanation. And I feel too, like probably in the situations I was discussing, is I rarely saw these doctors. So we didn't have a lot of time, right, to build that relationship ahead of time. So maybe that's why in those specific situations that it was helpful, because it was a very quick way to maybe like build some safety for that conversation. But then go ahead. Were you going to say something?
No, no, I was just gonna say I think that's true. I think to me that's partly if because this comes up, what if I've only seen somebody once? And I'm like, let me ask you, if you only saw somebody once, has anyone ever given you one piece of feedback that's changed your life? Like most people have had some interaction, some feedback where maybe that person only gave them a brief snippet, but it's something they do forever. So I feel like you have to give the feedback. So I think the other option, like not doing the sandwich, would just be to say, like, hey, look, I know we haven't had a lot of interaction together,
Hmm.
but I genuinely care about you as a physician. I care about us. would it be okay if I gave you some feedback? And then so the caring part, I care about you becomes the bread per se of the feedback sandwich, and that
Hmm.
you don't necessarily have to try to think, okay, what could I say positively
Yeah.
about this person?
Yeah, no, that's great. And what's interesting too is on one hand, you'd think, okay, a prescription for caring in healthcare leadership. You would think this book shouldn't be necessary, right? Like if you're talking about caring, isn't it a no-brainer, right? But like look how thick this book is, right? And I'm sure there's like even more that you could have said about it. So interestingly, when I found myself out of school just a few years, I ended up becoming the acting head of a physical therapy department at an outpatient facility, and I think I just naturally and intuitively had some of these skills because I know that when you were just speaking, like I did care about the people, I did care about the relationships, and they all knew that. So then when we did, when I did have something to say, they did know it was coming from a place, but if I had to tell them something, that I would tell them. So I did that intuitively, but it's so sad that it's not pervasive of enough that we need a whole book about it.
Yeah, I mean, it's interesting. Mark Crowley, who wrote my introduction, actually talks about that. You would think in healthcare that taking care of people and leading with caring would be the natural state. I actually think in many ways it is our natural state, but we've forgotten that, or we don't do it as intentionally as we should. So the book is sort of that. It's a call to our roots as like caregivers, that we should have that same level of care when we're leading. And I think the other word you mentioned to me is the intentionality about it, because there are certain people that some of these things may become more naturally to, and even in the book there's a lot of chapters. Some chapters you might look at and say, oh, I do this all the time, and then other chapters you might be like, oh, I've never thought of that. And the whole point of the book, and each chapter has these prescriptions for caring, like it's the
Mhm.
end of each chapter. These are intentional acts you can do. What we're trying to do is demystify leadership. It's not some magical, art that people, have to go and learn about. It's here's the intentional steps. If you do these things, they'll be effective. And I mentioned earlier the sort of evidence-based leadership. What I tried to do in the book is, hey, these aren't just all anecdotes or my ideas. I mean, one, I interviewed people, but two, like here's the data behind it. Here's the evidence for these
Mhm.
particular practices so that we can practice evidence-based leadership, not just evidence-based medicine.
That's important. And even a lot of doctors, they're like, show me the science. So when you have the evidence to back it up, that's fantastic. So to share one specific example, I like the way you shared in your book about the positive work environment and a fun way to connect. When you have new people come on, did you want to share that?
Well, there's so many ways to connect. I think like creating connections at work is really important. And, I think for me, one, it's an individual level, just learning about the person, but we've been thinking about how to do this also as a group. And just, whether it's having meals together or for our work unit, we recently had a bake off. We had people, and it wasn't just a bake off of like, bringing anything. It was bringing a dish that's like important to you. And then we had them talk about why it was important to them, right? Why did I bring in this particular cookie? Well, I brought in this cookie because this is what my mom and I always made when I was growing up. Or I brought in this cookie because it was my grandma's recipe. And like
Yeah.
every time I have it, it just makes me feel like home. Like it was just a nice way. One, we got a lot of good dessert. Two, you got to learn a little bit about the people and what's important to them through the experience of sharing in that case the baked goods. But there's a lot of evidence growing or coming out about the importance of connection at work and feeling connected. So
Mhm.
whatever ways you do that, and I think it's unique depending on your population of who you work with. I think you also need to be inclusive, right? Like we think, okay, maybe play sports. Well, not everyone does sports. We
Right.
traditionally thought about, oh, well, let's go to happy hour. Well, not everyone drinks and not everyone wants to go to happy hour.
Yeah.
So thinking about how do you do this inclusively so that you have different types of events, different types of things, so that everyone can, one, feel involved, but also can have those sharing and bonding opportunities.
Yeah, I love that. And the one page that it brought to mind was you said if you asked them if they were going on a road trip, what are the five snacks they could not live without?
Yeah, and that was one of the people I interviewed, and Chelsea who did it, she would then like send them those snacks months later, right? I mean, just imagine getting like a package of snacks, months later, boom, someone is dropping off whatever, wasabi almonds or,
Yeah, yeah.
pick your snack. But it's just a nice personal touch to show that you care about them.
Yeah, no, I love that. And so I'm hoping that, we're making, as Todd Otten says, ripples of change. And then I say that it'll turn into waves and then a tsunami. So I just want to give you, the opportunity for a few more minutes to just share with us how can we bring caring, love, and compassion to healthcare systems? What is your vision? What is your hope? Anything else you'd like to share?
Yeah, I guess my hope, boy, like what would be the dream? The dream would be that everybody from the individual level, whatever you work in your organization, all the way up to the, CEO, deans, think about what are the daily intentional actions I can take to invest in and care for the people around me.
Hmm.
And the reason why is just imagine going to work and feeling like you
Yes.
are really cared for, that the people who are next to you,
Right.
above you, below you, but that you all care for each other. I think when you're part of an organization like that, you just do such a your work first off is way more productive. It's way more impactful. And not only that, but you feel better. You feel alive, you feel energized, you feel connected. So I think figuring out ways to get those intentional acts of caring leadership throughout our organizations. Obviously, I wrote the book sort of to be the manual, the playbook for that. You
Hmm.
know, give the book to somebody and say like, "Hey, I read this. There's some great tips in here. It might be valuable for you." Um, share it with somebody influential in your organization and say, "Hey, this was a great book. What do you think?" Just make the efforts. I think if all of us every day were just to sort of look at it and say, today I'm gonna positively impact three people's lives, and I'm not
Hmm.
gonna leave work until I do that. You could probably finish in about 15 minutes, honestly, depending on the day.
Right.
But other days it may take longer, and it doesn't have to be grand acts. Sometimes, like you said, it can just be as simply as smiling. It could be as simple as holding the door for somebody who's struggling to get
Hmm.
from the patient parking lot into the hospital or into your clinic. It could be asking a colleague like, "Hey, you seem a little down. Everything okay?" Right? I think just the dream, the vision would be that from top to bottom, we embrace this idea of caring for each other so that we can care for our patients and take care of our trainees, uh, both in the way that we want and I think that the way that we deserve in healthcare.
Absolutely. And the culture of medicine has to change from even med school, because I've heard horror stories and sometimes it's fellow physicians or, like higher ups, their supervisors that really tear down their colleagues. And so it needs, but then some of them, I guess, think, well, it toughens them up or that I had to deal with it, you can deal with it too, or they're hurting, right? And they say hurt people. So again, just to shore up yourself so you can be available and have a positive mindset when you're interacting with other people. And I have to say, in my own PT training, we felt that in school, and our instructors were supportive of us. We were supportive of each other. And even I think like PTOT speech therapists, we often have an advantage that we do work together as a team, and we do have that collegiality. And I always became friends with the people I worked with, and we would. And lots of times, you're in like a gym, and you're together, and the patients are together, and you could be doing hard things, or the patients doing hard things, but you can still like laugh and joke around, and and all of that. Now, of course, even that became way more difficult with the EMR, because then even because then you're sitting, like we were never sitting at with computers and with the patient. There was never a computer between us and the patient. So we have to bring back that Because then even at lunch, like we would talk about like just the therapist, like, oh, if we were concerned about a patient, did they need a social worker, or even what did you do this weekend? But once the EMR came, like I literally changed what I brought to lunch so I could eat with one hand and type with the other hand, and that's what everybody was doing, and we lost that, and we have to bring that back.
Yeah, agreed. And we can. We need to think intentionally about how we lead differently and how we follow differently, how we interact with our colleagues differently. But these are all possible. We have the opportunity every day to have these interactions, and we can say, well, we need to fix the system, or I wish my dean or CEO or someone would do this. And I agree, we need to have system-wide change, but we can start that sort of revolution at the individual level. And we
Hmm.
continue to push and advocate and build, as you said, that culture and let that then spread throughout your organization so that we can have a better culture for all of us.
Well, I love that you're spreading a message of hope. So between both of our books and everything that we're all doing, we'll all make a difference together. So thanks again for being my guest, Josh. I really enjoyed having you.
Thanks again. And I love your book. I look forward to our continued work together on this important stuff. Thank you.
You're welcome. Absolutely. So, in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So, stand up, doctors, and let's stand up for doctors.